All narcotics and dangerous drugs have legitimate medical uses. Many are indispensable for pain-killing and sleep-producing properties. But in the hands of the addict, their use is perverted to secure an escape from reality.
In the world of addiction, we think of opioid use disorder on one hand and all other substance of abuse on the other hand. And the reason we make that distinction is the deaths. And so the real scare about prescribing opiates for pain or for people that get stuck on opiates or experimenting with substances on the street is that they'll have an accidental overdose and they'll die. So opioid use disorder is when you're using opioids in a way that impairs your function. And this can happen quick with opioids because they're a very difficult molecule to stop using once you take it. It provides, for some people, a very dramatic intoxication state that one wants more of from a prescribed opiate or from opiates used on the street. And you can get very quickly into this physical dependence on it where it becomes very hard to not use or you go in withdrawal. And sort of the physical pull of opiates then leads to all these functional impairments in your personal life, family life, work life, and then you end up with an opioid use disorder.
I'd gotten out of jail, and it wasn't long before I had made some fake checks. I robbed somebody, and I had got some money together. I started using again, but I'd actually had a good rapport with one of my caseworkers at the outpatient I was going to. So she's like, look, you're gonna die. And so many of my friends, I'm pretty much the last one out of the group of friends that I hung with when I was younger that got into heroin. So, I think of them and, and I just, they let me know that I have no reason to complain or anything to feel bad about anymore. So that's kind of what keeps it green for me.
As an addiction provider, I'm very hopeful for people who are misusing substances or have an opioid use disorder. There's more people in recovery in the United States than with active substance use disorder. And when you're in the middle of an addiction and a substance use disorder, it can feel hopeless at times. It can feel like it's something you want to hide. But it's my experience, once you get it out in the open, once you involve family, once you get the right treatment, that outcomes can be very positive. And we know there are good treatments for opioid use disorder. The meds classified under medication-assisted treatment, the psychosocial treatments, they're out there and they can help. And I've treated many and certainly many around the country that get better and go on to lead the lives that they want.